Hi guys, welcome back to Skincare Sunday. Dr. L here at Revital. I'm going to take a little break of the Beyond Botox series. I know a lot of you enjoyed last week when we talked about skincare and reversing aging beyond Botox. Today I'm going to address an article that I saw on CNN and I got a lot of messages about regarding some Stanford data showing that there are specific ages, 44 and 60, when we see advancement in the processes of aging. So I wanted to address that article and what can we do to be proactive? What happens at those ages? And I do think there's some information there about advancement and particularly accelerated aging at those two ages. And what can you do to work on that process before it happens? So one process that I want to start with is the discussion about the molecules that keep our tissue together. Those are in the skin, the collagen that keep our skin firm and the elastin that keep that skin tight. Those see accelerated loss at around age 44 and 60. And that makes a lot of sense to me because perimenopausally for women, specifically 45 to 55, that is that time when we lose a lot of that supportive tissue that is being supported by our female hormones that come from the ovary. But even in men, we see advanced loss in our skin of those molecules that keep it nice and youthful. So if you're nearing that age, or even better, work before you near 44 and 60, work on things before. Just like being active, physically active can improve your health and improve aging even before you hit middle age. In the next couple of weeks, we're going to talk more about, we talked last week about how we can rebuild collagen and elastin, the molecules that we see advanced aging loss at 44 and 60. Those molecules can be rejuvenated. They can be brought back in time. We can be proactive in our 20s, in our 30s, in our 40s, 50s about these processes that are occurring in our skin as we age. Now, other things are also occurring. Our metabolism is changing. We're gaining fat at those particular ages. We're losing muscle. The way we metabolize things like alcohol, even the way we sleep, the way we tolerate caffeine, for instance, all those processes are occurring. So in general, when it comes to those peak advanced aging processes that occur in the mid-40s, at 60, being proactive on working on your body ahead of time will get you a long way. On a personal note, I just turned 45 a couple weeks ago, many of you know, and 44 is like the advanced peak aging process according to Stanford. I feel like I feel my best at this age than I ever did. And I feel like I look youthful and fresh. And, I actually read some data recently that looking more youthful than your age actually improves not just longevity, but the quality of your life. So working on reversing aging, working on before you hit those peak ages, 44 and 60, in that particular window of, 45 to 55 or so, before that window or during that window to really go aggressive on reversing skin aging, building collagen and elastin, reversing bone aging in our face, as well as fat pad loss. So all those things will keep you youthful and will get you right through that bump of 44, which I already went through. And not only will it get you through it, you'll flatten it out. Not only will you flatten it, in my practice, we're going to reverse it 10 plus years. We'll take you back to the 30s if you're in your 40s. We'll take you back to your 40s if you're in 50s. And the earlier you start on these processes and be proactive about these advanced aging processes that are going to happen to us, the more natural you look. And these things take time. You guys know I'm about natural results. So natural results take time, making collagen, elastin, rebuilding bone, working on those fat pads of facial aging that are being advanced at those two particular ages. Those things take time. So let's get in. Let's work on those processes. Each treatment that's going to be recommended for those processes is going to be different based on how you've aged so far. And of course, your numerical age as well. All right, I hope that was a little bit helpful in understanding that new data about aging. Don't be scared of 44. It's not a big deal. Been there, done that, past it, looking and feeling better than ever. We can get you past it, and not just past it, back, reverse. being actually more youthful, not faking youthful, by rebuilding those things. So good to see you guys. See you guys next week.